Hello and welcome to this video about atrial flutter. Atrial flutter is a type of abnormal heart rhythm that occurs when the upper chambers of the heart, called the atria, beat too quickly. In this video, we'll discuss the causes, symptoms, and how to analyze atrial flutter. Atrial flutter can be caused by a variety of factors, including underlying heart disease, such as hypertension or coronary artery disease, and other medical conditions, such as thyroid disease or pulmonary embolism. Certain medications, such as stimulants or some antidepressants, can also trigger atrial flutter. In some cases, atrial flutter can occur without an identifiable cause. The symptoms of atrial flutter can vary depending on the severity of the condition. Some people may not experience any symptoms at all, while others may experience palpitations, chest discomfort, shortness of breath, or fatigue. In some cases, atrial flutter can lead to more serious complications, such as stroke or heart failure. Atrial flutter is a type of cardiac arrhythmia characterized by a rapid, regular atrial rhythm, usually 250 to 350 bpm, and a slower and usually regular ventricular rhythm with a ventricular rate of 75 to 150 bpm. The pathophysiology of atrial flutter involves abnormal electrical activity in the atria, which can be triggered by various factors. In contrast with normal sinus rhythm, in atrial flutter, there is a re-entry circuit that forms within the atria, which allows electrical impulses to travel in a circular pattern rather than in a straight line. This circuit is usually located in the right atrium, near the tricuspid valve, but can also occur in the left atrium. As a result, the atria beat rapidly and regularly, but the ventricles may beat at a slower and irregular rate, depending on how many of the atrial impulses are transmitted through the AV node. Let us do an analysis of atrial flutter. Step 1. Assess the regularity of the rhythm. Despite having the P waves exhibit rapid rate, the atrial rhythm remains regular, as do the QRS complexes. Step 2. Calculate the heart rate. There are two rates, an atrial rate and a ventricular rate. First, determine how many P waves there are for every QRS complex. This represents the ratio of P waves to QRS complexes. Next, determine the ventricular rate by counting the number of QRS complexes in a 6-second section, then multiply that number by 10. You can then calculate the atrial rate by multiplying the ventricular rate by the number of P waves to each QRS complex. So in this example, there are 7 QRS complexes in this 6-second strip, which we multiply by 10 and get 70 beats per minute. Next, we determine the P wave to QRS ratio by counting the number of P waves before each QRS complex. And in this example, there are 4 P waves to each QRS complex. Since we have the ratio, we can multiply 70 by 4, which gives us 280, which is the atrial rate. It should be noted that this is only possible if the rhythm is regular. Step 3. Identify and characterize the P waves. The P waves exhibit the characteristic flutter waves, which show a rapid and regular positive inflections covering the isoelectric or baseline. Step 4. Measuring the PR interval. Since there is more than one P wave for every QRS complex, the PR interval cannot be measured. Step 5. Measure the QRS complex. Similar to a normal sinus rhythm, the QRS complex is normal and narrow, and has a duration of less than 0.12 seconds. In conclusion, atrial flutter is a type of abnormal heart rhythm that can be caused by a variety of factors. The symptoms of atrial flutter can vary and can be serious if left untreated.
Thanks for watching. Subscribe and smash the like button. It will cost you nothing, but it will help us immensely.